Hi, and welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the second video in this exercise program for finger arthritis or tendonitis. If you have what I described in the first video, so you've got some swelling and pain and stiffness in a finger or more than one finger, then check this program out and view the rest of the video, see if this will work for you. I also mentioned in that first video, though, if you have recently injured your finger or hand or fingers and you're having a lot of sharp pain, you have a lot of swelling, even some redness and heat or some numbness, then you need to go and see your doctor. It's probable that you're dealing with something else besides just arthritis or tendonitis, and you need to give your doctor a chance to look at that and see if there isn't something else that you need. So let me show you the two techniques for this video. The first one is just a massage technique that you're going to use, and then the second technique is for passive motion, which you're also going to do to yourself. So let me show you the first one, which is just that massage technique. You want to take that painful finger or fingers and just place that in the palm of your good hand, like that, and you're going to use mainly your index finger and your thumb on the good side, and just use that thumb and finger to just move down along the painful fingers toward the hand, like that. You can do the back side of that, the inside, so either side of those fingers, just like that. You always want to start at the tip of the finger and move down toward the hand. Now, the amount of pressure that you want to use is up to you. You can use a lot of good pressure just to, if you could just imagine pushing that swelling and that stiffness out of that finger. That's the kind of pressure that you want to use, but certainly the amount of pressure that you tolerate. So I don't want you squeezing or pushing so hard that it actually irritates those fingers. When you do this, you can do this for several minutes, so up to 5 minutes, and this is always going to follow that ice or heat that you choose to do. And I want you to do it at least twice a day. You can do it more often than that if you feel like it is working for you. And you can do this just about anywhere. I'm holding my hands up like this just for video purposes, but when you do it, I just want you to have your hands resting in your lap, your shoulders, and your arms relaxed. And again, like I said, just massaging those fingers. If you have someone at home that will do this for you, they're willing to do it for you, that's even better because it feels better when someone else does it. So the second thing that I want you to do, so after you do that massaging, then I want you to do some passive movement. And you're also going to use your good hand for this. So you'll take that finger, or if it's more than one finger, and I want you to actually bend those fingers all the way down and straighten those fingers out as much as you can. It's important that you always go as far as you can in each direction because I want you to emphasize or try to regain some of that motion that you may have lost or that you're losing. You did have normal motion in those fingers at one time, and that's our goal. That's what we would like to, or you want to get as close to that as you can. So again, it's just taking those fingers and bending them and then trying to straighten them out. You can even do one joint at a time, so you can kind of see here, I can bend just that first joint, I can bend just that second joint, and then I can bend at the knuckle. Let me show you here in my pinky. So there's the first joint, second joint, and then at the knuckle. And I can do the same thing for the straightening. So I'm trying to straighten that first joint or bending it up and back. I'm trying to straighten that second joint and lift and straighten that third joint. For these, I want you to do just one set, and you're going to do 15 to 20 of those. So it's going to just take you a little bit of time. I want you to do it twice a day, just like you do with the ice and the heat and the massaging. You can do that more than twice a day if you feel like it's helping.